about everyone who touches, everyone, all the stakeholders that touch AOT. We usually have representatives from all the groups. I think we've got a judge that might be joining us today. We've got providers. We've got family members, other advocates. We've got mental health authorities with us. We've got just a little bit of everybody. So that makes this for a more kind of cross-systems discussion. I'm just going to introduce myself and ask my colleagues to introduce themselves for those of you who don't know us. And then I'm just going to quickly kind of run through the folks that we have here. If you could just do a kind of quick introduction, your name, where you're from, and how you're connected to AOT, that would be great. So for those of you who I haven't met, my name is Betsy Johnson. I'm on the implementation team at TAC. I wear the sort of the family member, kind of grassroots advocate hat on our team. I'm joined by Brian and Amy. I'll let Brian, if you'd introduce yourself.
Sure. Hi, everybody. I'm Brian Stetton. I'm the policy director at TAC and tend to focus on the legal judicial aspects in our AOT implementation work as a lawyer. So great to be with you.
And Amy.
I'm Amy Lukes. I'm a social worker by training.
Okay, I'm just going to go from left to right across my screen. I'll just call out your first name and just do a quick introduction. That'd be great. So Lynn, you're top of my screen there.
Hi, I'm Lynn Gibbs. I chair our NAMI affiliates public policy committee, NAMI Santa Barbara County. And we advocated for Laura's Law for many years, finally got it, but now we need to make significant improvements to the program. I also moderate a Google discussion group called California Advocates for Treatment that focuses on treatment for serious mental illness. Thank you.
Thanks, Lynn. So glad you could be here. Anne.
Hi, my name is Ann Cochran. I'm a nurse by profession, but I have a son that lives with bipolar disorder, and I'm from Massachusetts. Just recently got into advocacy maybe in the past 3 months, and we're advocating for an AOT law here and have made some huge connections in the meantime, and hopefully it will get passed this time around.
From Massachusetts.
Yeah.
We're here to help you, Ann. We're so glad you could.
Well, all these years.
Lisa.
Hi, my name is Lisa Baumann, and I'm a family member. I just started advocating for AOT in January. I worked for NAMI on their warm line, and I led a family support group, and I realized how important AOT is to help a group of people that just aren't heard and they're just neglected.
Thanks for being here, Lisa. David?
I'm David Larson. I am living in Wichita, Kansas, but I am working for NAMI Kansas. And I am I've been to a couple of AOT trainings and things like that. So I'm just always wanting to learn more about AOT.
Terrific. So glad to have you here, David.
I'm a peer.
And we were just on the phone with Becky Mangle from Wichita yesterday. Do you work with Becky? Yeah. Laura.
Hi, everyone. I'm Laura Braun. I'm the program manager for the AOT program in Albuquerque, New Mexico. Thanks.
Welcome, Laura. Sherry?
Sherry Vaughn. I'm the executive director with NAMI Kansas, and our state, what we call KDADS, Kansas Disability and Aging Services or Department. I can't remember. It's KDADS. They just received a SAMHSA grant to implement and pilot new AOT programs in 5 of our counties, 4 of which we have a good, strong NAMI presence in.
So, congratulations. That's great. Martha.
Hi, everybody. I'm Martha Stringer. I'm in Bucks County, Pennsylvania, eastern part of the state, and I've been advocating for AOT here for about a year. I think we asked for some money. This county asked for some money and hopefully we got it, but I'm not quite sure where we are in the process. It's been a little bit contentious, but we keep pushing forward.
That's state money that you're talking about, right, Martha? Yeah.
Yeah, Pennsylvania opened money up for counties to ask for money specifically to implement programs like AOT.
Right.
Yeah.
That's the way they're using some of their COVID relief funds.
Yeah.
Yes.
I was actually going to talk a little bit about that later today, Brian, just to share a little bit about an opportunity for folks to champion the possibility of getting some new money through your state through some new SAMHSA dollars. But we'll talk about that in a bit. Ash.
Hi, I'm Ash Warren. I'm a social worker by trade. I am the AOT coordinator in King County, Washington, which is where Seattle is. And we've done some version of AOT for decades, pretty poorly. And I am interested in making it work right. And so doing a lot of leveraging now. I'm at sort of this point where I think I have the stakeholders behind me. We did a tiny little pilot project called the Recovery Pilot Project, where we're doing the court component. And I've gotten a very adversarial court to work together. And so now it's time to do the diversion AOT orders and help people avoid the hospital when they don't need it. So I've reached out to Brian recently, and he's going to help me try to figure out some legislative changes and ways to implement all of the law. We have the law on the books. And no one's sort of been willing to get in there and get messy and find more resources to make it happen. So that's what I'm trying to do.
Glad you could be here. Megan?
Hello, I'm Megan Hebert. I work for Oakland Community Health Network, and I am the mental health court liaison. But part of my role, I've been assisting with trying to collect some data here in Michigan within Oakland County about, we call it Kevin's Law, or AOT, and we're really trying to improve our program, see what we can do to make some significant changes, better help the people in our county.
Thanks, Megan. Janet.
Oh, you caught me off guard. Hi, Betsy. Hi, everybody. It's good to see you all. I'm about to do my PT, so I am going to go off video after I introduce myself, but I'm very much here and listening and interested in what all of you are doing. I'm in New Orleans, Louisiana. I started my own nonprofit to fill a vacuum that no one else is filling. And really, we're an advocacy organization, but because there was interest in the state of implementing our AOT law that's been on the books for 2008. A couple of years ago, I went to a judge to create a program in New Orleans because no one else was doing it, complaining that they didn't have funding. So I just went to a judge and said, let's do this. And he said, okay. And away we went for free, which kind of shut us out of receiving federal dollars later on, so I'm interested in what dollars might be available for existing programs through SAMHSA. Hopefully we'll hear about that later. But anyways, it's great to see you all. We're working through some major gaps and we're doing language revisions to our law right now because there was some language put in the law that required interested parties, i.e. family members, to have medical records and the written concurrence of our coroners. Don't even ask me about that, but medical documentation in order to file a petition, which in many cases is simply impossible. So it's just been a poison pill that's prevented us from getting people that need to be in the program. So I'm now a lawyer. A lot of us have become lawyers and looking to hopefully get a piece of legislation passed next week that will allow us to move forward with petition.
It looks like you guys are well on your way, right? It seems like that bill's going well from what I've gleaned.
Yeah, we have some opposition from some folks, the judge in the parish, and so they've written a couple of senators on the committee next week in the Senate about their complaints. And so, we're working right now on new concerns that just came up this morning. But, it all boils down to the same response in that, we need to remove these barriers to allow family members and interested parties to petition for people who are eligible. So, we'll get there, I hope, but fingers crossed. Thank you for your help, Brian, and the support of everyone at Treatment Advocacy Center also.
Sure thing.
Good luck, Janet. Let's see, we've got Megan from Cuyahoga County. We've got two Megans today.
Hello, everyone. I'm Megan Rodsford. I'm the program director for the NAMI chapter of Greater Cleveland. I'm also a family member and a psychotherapist by training. And I'm just here to help our AOT program here in Cuyahoga County be the best that it can possibly be for the families that we serve.
Thanks, Megan. Barbara.
Hi, I'm Barbara Murray, and I am in California, and I am a family member of a daughter who has bipolar. I'm also interested in advocating for NAMI and for the mentally ill in any way I can. I also worked for a year at Step Down Housing program here in Santa Barbara, and which my daughter is now in that program. I just really want to advocate for anybody to avoid. I just went through, my daughter was incarcerated for 14 months. 3 of those was at the state hospital, and she finally got released. Of course, COVID had a lot to do with that, but at the same time, you know, just helping the mentally ill find beds and help the programs to facilitate those in need, and giving the families, like you said, access to helping those that are refusing service and need it desperately. Thank you.
Thanks, Barbara. Well, you're in the right place. That's what we're going to talk about today. My dear friend, Ruth Samara.
Thanks, Betsy. I'm Ruth Samara with the Coordinating Centers of Excellence at Northeast Ohio Medical University, which includes the Best Practices in Schizophrenia Treatment Center, the Ohio Program for Campus Safety and Mental Health, and the Criminal Justice Coordinating Center of Excellence. So that's a mouthful, but collectively, those centers really advocate across all systems in the state to try to ensure that people in Ohio have access to the best possible care and treatment for serious mental illness, whether that's through CIT programs, AOT, et cetera. And specifically, Treatment Advocacy Center works heavily in Ohio to disseminate AOT, assisted outpatient treatment, and we try to help do that by serving as some double-sided tape with our local communities and advocating with communities that are not yet on board.
Like that. Annabelle.
Hi, good afternoon. My name is Annabelle. I go by Belle. Fairly new with the City of Albuquerque. I'm a program specialist, and I'll be doing SAMHSA grant oversight.
Thank you. Mackenzie?
Hi, my name is Mackenzie Tomasic, and I am a program supervisor for the Pinellas County in Florida AOT program. We've been up and running for about, we're sunsetting on the 4th year of our grant, or 3rd year of our grant. So almost 3 years now.
Thanks for being here. Tina.
Hi, I'm Tina Delpy with Fort Myers, Florida. So yay, Pinellas, I'd love to learn from you. And I'm originally from Kansas, so yay, Sherry. I'm with Kaiser University. I'm an occupational therapist by background, but have starting to partner up with one of our agencies that has a SAMHSA grant, Centerstone, who has a SAMHSA grant for their AOT program, and seeing how we can help them get the word out to referring physicians and get more participation in their program. So that's what myself and some of my students are going to help out with.
Oh, fantastic.
Awesome.
Tina, can I ask real quick if you're connected with Daleen Odell, who's just a real amazing advocate out there?
Oh, and that's why I'm on this. Yes,
Awesome.
she and I go way back.
Yeah.
Good deal.
Not surprising.
Okay, we've got Elizabeth.
Hi, everyone. My name is Elizabeth Hernandez. I am from El Paso, Texas. I work for Emergence Health Network, who is the mental health authority, and I am a caseworker for the AOT program here.
Right. Glad you could be here, Elizabeth. Kathy.
Hi, everyone. Kathy Yunker. I'm from Oakland County, which is Detroit area in Michigan. And as Megan Hebert mentioned earlier, we are very much interested in developing our program beyond just the orders being put in place. I mean, treatment is, of course, provided, but we're really looking to establish all those essential elements and working hard toward that. I am going to have to jump off the call in a few minutes to join a statewide crisis partners group. And I will be bringing AOT as a subject to that group as well. Just trying to make connections to a lot of the other places where there could be overlap.
Right. Well, thanks for joining us, even for a short while, Kathy. Linda, I believe you're our last one.
Okay, hi, I'm Linda Mikologic. I live in Austin, Texas. I'm a member of NAMI Central Texas, and I'm on their advocacy committee. AOT started in our city about 9 months ago, and we have a SAMHSA grant. I also am the parent of a son with a serious mental illness who's in our state hospital right now. And if all goes well, he will get the AOT program when he gets discharged. He has a lot of issues with anosognosia, so they're working with him kind of already to try to get him interested in it, but it's going to be a work in progress. But I'm always interested in your meetings so that I can learn things and just help others as well. Thank you.
Thank you, Linda. So I thought what I'd do is if we could just sort of kick this off with a nice positive story. You heard earlier, Santa Clara, California, just this last week, their local government opted into implementing Laura's Law out there. And Lisa was very much involved in that effort. So I was curious, Lisa, if you could maybe share what, in your opinion, were some of the what sort of put this over what was the tipping point for AOT in Santa Clara, and where did the champions, what role did they play in making that happen?
I think it happened pretty quickly. At the end of January, I had already been talking, just kind of poking around, trying to figure out where people in the county, what they were thinking. And I could see that in the government level, nobody even really knew about Laura's Law, and they were acting like it wasn't a big deal. And so I knew that without getting the county, especially consumers that work in the county, educated, nothing was going to happen. And at the end of January, NAMI Santa Clara County really wasn't willing to make a letter or announcement in support. Privately, they supported it, but they weren't willing to do anything about it. And so at their next board meeting, there was a proposal to actually send a letter to the county supporting Laura's Law. I think that was huge. Once NAMI got on board, I think that they're very well connected in the county. A lot of their members work in the county. That was big. The other thing was that the consumers in Santa Clara County have a big fear about Laura's Law and how it's going to impact them. And I think changing their thinking about it, educating them that Laura's Law is actually empowering and that is destigmatizing and that they should want it, because I think that it will help them. And I think that was where I tried to focus on. Anybody that I knew that knew a consumer that was in the county working, trying to educate them on it. I sent we had a video of Carol Stanchfield and Randall Hagar, a 10-minute video, and I'd send that to anybody so that they could see that AOT was actually a good thing.
Just for everyone's benefit, Carol Stanchfield is one of the real innovators in using AOT in California, right? She's the program director in Nevada County, a rural county where Laura Wilcox, the person who the law is named for, is from.
Right. Yeah. And I think I used a lot of the information that I gathered from Lynn Gibbs. She has a really good group, and a lot of the lessons that they've learned, I took that and I tried to tell people about it. And I just tried to find out where there was resistance and educating people. I actually just started to talk to people who didn't have any mental illness in their families. And it turns out they would know somebody, and it kind of connected them to the idea that this problem, we're having a huge homeless problem in Santa Clara County. It's not just a tent here, a tent there. Every single town has a bunch of encampments, and it's a problem that people can get behind or see that it's like right in front of you. And And mental illness isn't necessarily the problem with all homelessness, but I think this chronic homelessness is an issue that AOT might be able to help with. I also started to talk to people that were connected to the supervisors, because I couldn't quite get to the supervisors. They were guarded by their analysts. And I started to talk to people about Laura's Law, and they were like, wow, I can't believe that our supervisor isn't for it. And so they would talk, and then they would be silent. And so I didn't know if they were making an impact or not. I could tell that there must be resistance at the supervisor level, but I felt they were doing their job. And so I just kept talking and talking and talking to people that why they should be concerned about this, even though it's only supposed to impact a few people in our county. I just kept talking. So that's the piece that I did. But I know that a lot of people just started to tell people that they knew to send letters in. And there was a huge letter writing campaign. A lot of people did. So.
Awesome.
Right. Good.
So, one thing I'll add to everything Lisa said, which is phenomenal, is that I think one of the factors that really made a difference is that we had an elected official who really was just so passionate and so bought into this and helped bring this to the kind of shame the Board of Supervisors into action. And that was a member of the San Jose City Council, Matt Mahan, who's not, he was not on the actual board that's making this decision. This is not something that's done on the city level. It was the county board that had to approve it. But, having him advocate for it and writing op-eds and, the personal connections he has to so many of the members of the board, I think was a huge factor. Wouldn't you agree, Lisa?
Yeah, he organized a bunch of groups of people and a lot of nonprofits and just a lot of stakeholders to sign his letter. I think he got over 400 people to do that.
Yep. So always a great thing to find an ally in government.
Yeah, that's a great point, Brian, because Amy and I were just talking to a group actually down in Hawaii this week, and they're at the early stages and trying, just sort of starting on their, AOT implementation journey. And, we were kind of talking to them, who are the key leaders that they need to, to recruit. And the woman said, well, I don't know any of the judges, but I do know a former mayor who's really closely connected. So she's going to go to the mayor and ask the mayor to make the introduction. So it doesn't have to be necessarily a decision maker. It has to be anybody who maybe has, some clout or has a personal relationship. So you really got to do your homework and talk to anybody that'll listen to you, and eventually you'll be successful.
I would like to recommend the 10-minute video that Lisa mentioned that features Carol Stanchfield. And you don't need to be in California for it to be relevant, but Carol just does an amazing job of describing what AOT is and how it works and why it works. And this was an excerpt from a program that California Advocates did that Lisa and her husband hosted. It was a Zoom meeting. But I think it's, is it publicly posted, the 10-minute video, Lisa?
Yeah, it's on YouTube.
Okay. Well,
if you could put it in the chat box here, I haven't seen it myself. I'd like to.
Yeah, and we could add it to our resource library too, Lynn, so that others, you'll have access to it. Since it's on YouTube, I don't think we need permission. That's great. Okay.
Let me see if I can find the site. If I do, I'll put it in the chat.
Super.
When we talk about champion AOT, oftentimes we sort of think about, champion AOT at the beginning of the process and getting the program implemented. But as many of you on this call know, it's a lot more than just getting the program implemented. It's once it's implemented, making sure that it is the best it can be, and then holding the program accountable. And it's also championing to ensure that it's sustained over time. Some of the programs represented today actually got some, federal dollars to get it started, and those dollars are going to go away, and it's up to us to make sure that those programs continue beyond that funding. So we wanted to talk a little bit maybe about some other aspects of Champion AOT. And we mentioned earlier, some potential funding opportunities. I don't know how closely you all are paying attention, but last week the U.S. Department of Health and Human Services SAMHSA office, the Substance Abuse Mental Health Services Administration, that funds a lot of mental health services in our states, announced that there's going to be a huge influx of new money. I think it was to the tune of, well, $3 billion for the whole behavioral health system. So half of that will go to the substance abuse system, and the other half will go to mental health. And it's primarily going to serve people with SMI and people, and children with SED. So this is this is in addition to money that they already fund. So this is supplemental. So as a $1.5 billion new dollars that our local states are going to be realizing here in just a matter of months. And I know, I'm here in Ohio, and, we knew this was on the way. So I know we had advocated with our State Department to use some of those monies to incentivize communities to implement AOT. And we shared our proposal with some friends in Pennsylvania. We had an opportunity to meet with their director of their mental health system, and we shared the Ohio proposal. And next thing you know, we heard Pennsylvania has made put some money, made some money available to their local communities to incentivize implementing AOT. So now there is this new money, and it's a lot of money. I can just tell you, in Ohio, it's going to be $45 million, and that's $45 million new dollars for mental health services. So we're about 11 million here. So you can probably just and I'll send a link to where you can find out how much your state is getting. But it's a lot of money, and it's not money that's currently being planned for. So this is an opportunity for champions to, reach out to their state departments of mental health and share these, these ideas with them. We can share the Pennsylvania proposal and the Ohio proposal, so you can kind of get an idea of what's being talked about here. I know Kentucky requested a copy of it at their state department, so they're looking at it. But it's a real opportunity, and now is really the time to to make your wishes known. A lot of, it's important to remember, a lot of the groups represented on this call today have statewide associations. If you're a provider, you have a statewide provider organization or a statewide NAMI office. Judges have a statewide, office. So I would, if you're not sure how to approach this, forward this information to your folks in those those organizations, and let them know that this is something that you think would really be useful to your communities, because I think they're really looking for new and innovative ways to serve this really high need population. So I don't think you want to ask for the moon. I think, really doesn't take $1 million, don't tell Samson this, but it doesn't take $1 million to implement a new program, and you could do it with, much, in fact, sometimes I think that is a disservice, because it, causes programs to, build them so big that when the money goes away, they're kind of scrambling to keep it funding. But a few dollars, $100,000 here or there, or even less, gets people to the table, and at least you get them their attention long enough to be able to convince them that AOT is the way to go. So we'll make those documents available to you. And encourage you to start talking to some of your state leaders about it. Does anybody have any thing that they want to share, or some ways that you're working locally to try and generate some state or local revenue for your program? Oh, good. Okay, well, we'll send those documents to you, and if you have any questions, feel free to reach out. I was hoping, too, we could talk a little bit about what folks are doing to help keep their, programs accountable. I was hoping somebody from Contra Costa, California would be on with us today, but I don't see anybody. But the folks there reached out. They were really getting frustrated with their program, and not sure how to, make their case to their program leaders about how, things that they thought could be improved with their program. So they reached out to the Treatment Advocacy Center, and we were able to hold a conversation with with the program leaders, their judge, and some of the, the advocates. And that conversation really went a long way. We were connected the judge there with another judge in California who's doing a really good job with AOT, and he was able to address some of the concerns they have. Just wondered if anybody thinks something like that might be a value in their community, or
It may be of value to us. We're about to have a change in leadership at our behavioral health department, and we've been continually advocating for improvement to our programs. So we're hoping to get some attention on that. This is Santa Barbara County.
Yeah, I take it you've been kind of frustrated with how AOT has been implemented so far in Santa Barbara. Is that fair to say?
Yes, in the 3 years of our pilot program, we only had 3 referrals to the civil court. And once the pilot, it's been 4 years now since the pilot began. When the pilot ended, well, I could go on and on, but what was a program became outreach and then a referral to ACT, so that someone is not actually in an AOT program. Once they accept treatment voluntarily, they get moved to ACT, and if the next day then they decide not to participate, you can't, there's no way to follow through with the AOT requirements. So we have a lot to work on.
Yeah, it's very sadly typical of the way AOT has been implemented across California. Not every county, but in so many counties, they're just so loath to put people under court order, as if a court order is some kind of a terrible thing, some kind of horrible thing. That they're not leveraging the thing that makes AOT special. The idea that a person feels a sense of accountability to the court. And I don't mean that in a scary way, like something terrible is going to happen to me if I don't comply, but just, the sense that there's a judge paying attention to my case, and, people matter, I need to take seriously, is so much a part of why this works, that it's been frustrating in so many California.
We had Judge Tom Anderson from Nevada County give a presentation, and he's amazing. He's been the longtime AOT judge in Nevada County.
Yeah.
Unfortunately, we didn't get many people from my county to attend, but we did get statewide participation, and people were really wowed by his presentation. And he's always happy to help and give presentations.
Yeah, he's a wonderful guy. Yeah. And certainly, all of our California advocates on this should keep in mind how generous Judge Anderson is with his time, and how willing he is to help folks understand that, you want to make the court order the default process here, because that's kind of the point.
Yeah, thanks. So we may be back in touch with you.
Great.
Do folks have things they'd like to bounce off of one another, ideas or questions or
frustrations you want to vent about?
I have some questions. Because Santa Clara County is going to be implementing AOT coming up, and I don't know how they're going to do it, but at the county level, even at the meeting where they approved it, there were many the county executive, one of the board of supervisors, behavioral health, they have a different opinion of what AOT is. And so how do you, before things get implemented, how do you change thinking? I mean, I've talked to some people on the criminal defense side in the county, and they kind of think that people need to learn their lesson. Like, that's how they get into treatment, is by learning their lesson. So they have to go homeless, if whatever it is, they have to lose all their relationships. And so how do you, I mean, I know that anosognosia is kind of the thing to counter that, but other than that, how do you get a whole system to think differently?
Great
That's
question.
$1 million question.
Yeah, no, it's a great question, and I would love to have lots of people weigh in on it.
I just asked Lisa. I'm riding my bike now, trying to get in shape. But do you guys have a working group, like a collaborative working group already, with diverse stakeholders at the table, all kind of working together to, have these discussions outside of the formal meetings?
Not that I know of.
'Cause that's one thing that we did right off the top that really helped. So we have about 106 people in our planning group now. They don't always attend meetings, but at the same time, we usually have about 30. And so we just combined the advocacy rights groups with family members, with the judge, with the mental health authority. Our public health department had to be there. Police, EMS, sheriffs. I mean, we just sort of got all of the stakeholders, in the room together. And it was a bit of they all wanted to come because they all have their own issues. But keeping them in the room was a little bit challenging at first, so getting them to talk to each other. But once we did that, it just removed everybody then. It removed any opposition from moving forward with the court. We still have other problems, but that's sort of coming from, those are other issues but as far as just getting buy-in to doing a court, that's how we did it. And it was great. And it led to other conversations about other issues and gaps for barriers for people with serious mental illnesses that we need to address too. But that was this is the OT group. So
yeah.
They're talking about an oversight committee, but I don't know if that would be.
No. Because oversight is where you're that's good. I think you need to have some oversight, and there has to be accountability and transparency in the system. But what you're trying to do is, you're trying to get folks to, rather than holding a big stick over them saying, you have to do this, because you're trying to use the, honey to attract them to the conversation and get them to and educate them.
So then your group, then how does it get their voice heard? How does that turn into change?
Well, so like I said, I went to a judge and I was like, hey, let's do this. And he was like, okay. And then there were already conversations going on in city government about AOT, and they were absolutely clueless about it. It was so irritating. And I realized that if we waited for them to do something, it was never going to happen. So I went to the judge and I said, we got to do this, or it's, we're just, this is going to go on forever. These talk, and nothing's going to get done. So once we started the court, then I contacted these other folks that were interested in doing something, that were having conversations, but were totally misinformed about what AOT is. And I said, hey, we're starting this group, and we don't want to step on anyone's toes. We don't want to leave you out. We'd really like to have a discussion. We want you guys to participate. So thankfully they agreed. And the judge, when you put the judge in the room, it makes such a big difference. It was so funny because I went to the judge, we had coffee, we're friends, but I guess no one knows that. And so then when it came time to invite people to our meetings, the mental health authority and the city were a little skeptical. So they wanted to have a meeting with the judge first to see if it was okay with him. And so he and I already had it all planned out. So then we sat in his court one day with these other two individuals that are key stakeholders in the law. And they said, okay, well, where should we have the meeting? And we're like, we're going to start at court. So it seems reasonable that we would have the meetings at the court. And they were like, is that okay with you, Judge? And he was like, well, yeah, I guess so. Yeah, this is so stupid. And so then we started having the meetings at the court. So once a month, we would meet in Judge Reese's chambers to have our stakeholder meetings. And when you're meeting in a courtroom with a judge, and you invite people to come, they want to be there because you've got the judge. So, that really helped, right? Just having that relationship and we have a great judge. I have to say, he's been there for 20 years and everybody loves him. He's just a really warm and, you know, kind of personalities. So that's how we did it. But I think, you know, if you put a judge in the room or anybody who has title, who you may be a sheriff or anyone you can build a relationship with, you know, the mayor, a DA, you know, that can say, okay, we're going to have these meetings over in my office once a month. We want you all to come, and then just start that.
Councilman Mahan comes to mind.
Yeah, I think so.
Right.
It's a good idea.
Mm-hmm. Yeah, those are great suggestions, Janet. And I'll recommend a couple of tools that we developed at TAC, which would be our AOT implementation white paper. We'll put a link to that in the box, but that's, you know, basically everything anyone should need to know about how to start an AOT program from scratch. And it lists, you know, the steps, the building blocks that it takes to get the program off the ground, and you know, the philosophy that ought to be understood and agreed upon by everyone beforehand. And we talk about both the need to have a, you know, a planning group with all your key stakeholders, and to have an oversight group that's monitoring it in an ongoing way. But we also have developed from that a tool called the learning modules. We'll give you a link to that as well. And that is really something that everybody who is hired to work in the program is actually going to be involved in any facet, including, you know, as a champion from outside, should take some time to view. It's like an online course that takes about 4 hours to complete, that walks through all the information that's in the white paper in kind of a more digestible way, where you kind of, you know, it's like an interactive PowerPoint basically that you walk through at your own pace. So, you know, we ought to have people, just as a matter of course, if they're going to be involved in what's going on there, take the time to complete that. We should encourage that strongly, I think. And, you know, I will also say that if you can get everybody together for that kind of initial meeting of, hey, let's figure out how we're going to structure this. I would love for us at TAC to have an opportunity to present to that group, if it includes people who may just have a very different idea, maybe a more California typical sense of how this is supposed to work. We don't want to, you know, Santa Clara be the next Santa Barbara where we're using court orders so sparingly. I would love for us to have an opportunity to present some data on, you know, to make our pitch of how we think AOT ought to work, and, you know, share some information about how this has worked and been successful across the country that will hopefully get people in the right frame of mind about how to structure this.
We have a great AOT judge. She's the one who does the LPS, the involuntary commitment court hearings.
Yeah.
A problem in California, and I'm wondering how other states do this, is that the behavioral health directors are gatekeepers for the court referral. And well, we've certainly found that to be a problem, and I know some other counties have as well. Is that typical? Is there any other kind of model for this? We just by law added judges as authorized referrals for AOT in California. But nevertheless, they refer to the program, and then the behavioral health director refers to the court, which seems kind of crazy to me.
Yeah, you know, at the end of the day, the judge is just an umpire. They can't bring, I mean, they can only rule on the cases that are brought before them. And we do typically, where we actually have AOT being practiced as a program, kind of rely on the program itself to bring the cases, and they can get referrals to them from lots of different sources. But the petitions ought to come from the program, and we have to have people operating the program buying into the idea that we ought to, you know, go to a court order at the beginning of the process, not as just as a last resort when nothing else has worked. So I think we really do need, I don't think without buy-in from the people, you know, at the county mental health department who are operating this program, we're gonna successfully change it. If that answers your question, I really think that's.
Yeah, we have buy-in from many people, and including, you know, staff at the department. So it's just been a loggerhead. So maybe that will change. Thanks.
Sure.
I think that engaging your treatment system is going to be a lot more difficult than engaging your courts. Just from what I've seen and heard, this is true also in Pennsylvania, that it's the treatment system that is being the most resistant to AOT. And so I think there is going to need to be a very, I don't know, I was going to say a handout. No, you're going to have to reach out to the treatment system, except that right now they have to do this, right? Is that correct, Brian?
They have to do something. It's just, yeah.
You don't have to do it well. I mean, they're not accountable.
Yeah.
Well, we're gonna try and keep them accountable. You know what? An AOT network in California would be really helpful right now, because it's not just Santa Clara, it's Sacramento, Riverside, I believe, county. I don't know where that is, but I believe
Yes.
they opted in.
It's a big county.
It is. Okay. I mean, there's a number.
What part of the state is that in?
It's east of Los Angeles County.
Okay. SoCal.
So I think we need to do something there to get everybody together thinking
Agreed.
the same way. So, by the way, I put the white paper and also the a flyer for the AOT modules, which gives you the link to access them in the chat.
Yeah, thanks.
Amy, I just sent you the Pennsylvania funding announcement. For some reason, it's not allowing me to attach the documents. So I was hoping maybe you could help me. But what's going to be attached is the announcement from last month, where they're using some of those dollars we talked about to incentivize AOT implementation. Linda, I wonder maybe if you could share a little bit. I know you guys have been reaching out to try and make sure that you guys got a new program in Austin, and the family members that were very involved in getting that program up and running. And I know it's had some hiccups, but you guys have been really sticking with it and kind of, nudging it in the right direction. I wonder if you have any words of wisdom you want to share with some of these other folks.
Well, as a parent, and there's a group of us advocates that maybe there's 50 of us, but maybe there's 5 that are really kind of core. And when we see something that we're like, this doesn't seem like it's going right, we'll start letter writing to, legislative people, commissioners, whatever, Health and Human Services commissions. We'll reach out to you guys. We have a support group that our local mental health authority has a person that helps lead us, and he doesn't work for them anymore, but he would get the program directors and managers to speak with our group, because a lot of times our group, the local mental health authority, is called Integral Care. They make it sound like everything is just perfect, and you'd think, wow, it's just marvelous, but they don't realize some of the people, how it really works, like at street level. like how people are sometimes dropped from the system because they won't engage. And we're like, well, they won't engage because they have anosognosia, so a lot of people, my son included, and a couple of us core people had our loved ones like he doesn't want help, so we'll just kick him out and figure it out yourself. But they kind of revamped their structure for administration, have different people in charge of different programs, and they want to meet with us like quarterly to give them input. I know when AOT, and the one lady, she helps oversee the AOT program. I don't know if, I guess as program manager, it'd be Tara. I don't know if that's her title, but she'll meet with us one-on-one and get feedback, and we express some of our concerns, and maybe sometimes we don't have it 100% right, but she said one big thing they were going to address is this deal of dropping people because they don't want to be involved. And it's like, if they were healthier, they would probably be engaged. But that's just kind of the way we've we just don't give up, and we just keep trying to knock on people's doors and getting assistance and
Yeah.
letting them know that we care, and we want to see a good program in Austin.
Yeah. And that's so important because, you know, it's always going to be the natural inclination of a mental health system to not want to deal with the most difficult patients. It's human nature. They want wins, right?
Yeah, yeah. Yeah, we were concerned, well, one of my friends, and you'll know who I'm talking about, Brian.
Yeah.
They didn't want her son in the program. He was going to be too challenging, and it's kind of like, you know, do you just want to have everybody be an A+ student? You got to take the tough ones, because that's what this program was made for
Right.
those with the worst situations, not the one that needs just like a little Band-Aid and a pat on the back and, you know, yay, success.
Yep.
I think that says a lot about the importance too of those quarterly meetings. I think, you know, as champions, we need to insist that those, you know, are regular meetings where you have that opportunity for feedback, and that's your, you know, your time too to ask for, you know, what are you seeing in terms of outcomes? You know, they're collecting data. They should be sharing it with the, you know, the advocates, and, you know, if there's good stories, you guys need to take those stories and start sharing them outside your small group so that, you know, other folks in the community are aware of this program and aware that it's having, you know, the benefits, and other families learn about it.
Yeah, and we also asked if they can, like, I mean, we know about it. We helped when Liz Baker was trying to get it started. She was asking the advocacy committee different questions and for ideas and stuff. But we said, like, hey, there's a lot of people that don't even have a clue, and probably even in the hospitals. And I said, if they can get like pamphlets, or especially for family members, that the AOT, they'd be like, what's that? You know, I mean, so they can get a better understanding. And, you know, like, you can tell them, but when you walk away from a meeting, if it's all new to you, it might be very hard to digest or remember what you had been told. So I think they are working on some type of, you know, like handout to give people to help kind of guide them through the ideas of what goes on with AOT.
Great.
I was hoping we're going to have somebody from Richland County, Ohio on this call. They registered, but they're not here. But I was going to ask them to share a story. They've had a recent success story, or a gentleman that went through their program, was really, really ill and came out and was just doing phenomenally. It really just turned his life around. And he was so grateful. He said he wanted to give back to the community, you know, by sharing his story. So they invited him to present at their they had an upcoming CIT training, and he presented at their CIT training, and it was apparently you know, just a huge hit. So the beauty of that is, you know, gives this, you know, this gentleman an opportunity to give back, which is important. But, and then it also, you know, by educating the CIT officers firsthand about AOT, you know, that was really a win-win. And so now he's got you know, he's got some comfort now, you know, in sharing his story. So now he's interested in talking to other groups. So, which is really exciting. So I think it's really important as champions that we keep up, you know, tabs on some of those, you know, success stories, and identify people who might be willing to share them, and start, you know, putting them out there. And I'm sure all of you at this point now have had an opportunity to hear Eric Smith and what a difference he's made in so many lives by sharing his story. And, you know, we love Eric, but he's not the only one out there, you know, so we really need to, you know, be watching carefully to try and identify other Erics in our communities. Does anybody have somebody like that they can think of, a participant in their program that's might be willing to share their story?
I don't know about that. I have a totally different, I have a son who was dropped from AOT in Santa Barbara, and we had every opportunity with him. My son's a very difficult case. He certainly doesn't think there's anything wrong with him. And the program, I feel the people really wanted to help him, but my son has a borderline personality disorder, and he would split on him every time. You know, they would be his friends until they weren't. And then he would send him nasty messages, like he sends to my wife and I all the time. And I think they just couldn't deal with it. And he needed a JDP. He needed the judge involved. He actually got in trouble in the when he was in AOT in the program, and it never went to a mental health court. It went to a civil court, and at the time he was a good-looking, young man, and they, to me, it's a tragedy that we can't help people get help. So the whole idea in my mind of AOT aren't the easy people. It's the people like my son. And countless times I had the AOT people telling me, you need to kick your son out and let him hit rock bottom. And, when he does, we'll be there for him. And I was just going, no, I don't want my son to be another one of the homeless people on the street and possibly end up either being attacked by another homeless person or ending up in jail and being attacked in jail. My son thinks he's a real tough guy, but he isn't. And the world breaks people. So I don't, like I say, my story is the exact opposite. I wish I could give you an uplifting version, but it isn't uplifting at all. It's we're going on 4 years now. He was in the AOT program for 6 months. And like I say, they basically just punted him to the ACT, and ACT eventually just gave up on him too. Because
And he was never under a court order. Is that right?
They never under a court order, never saw a judge.
Which to me means he was never
that's
in
what
AOT.
he needs.
He's a poster boy for someone who should have been referred to the AOT court.
Yeah, exactly. I would reject they tell you, well, he was in AOT, we tried it. He was never in AOT because he was never.
I agree.
Yeah,
So we need to change that.
For sure. For sure. Well, I'm sorry for everything you've been through or going through. I know a lot of people on this call relate.
I wonder, Laura, I know in your community, there's an opportunity for family members to refer loved ones directly to your program. Can you talk a little bit about what that looks like?
Yeah, we actually have a provision in our law here in New Mexico where a viable petitioner can be certain categories of family members. And so we have a direct path as part of our screening and evaluation process. We have a qualified professional on staff as part of our AOT program. We're currently in our 3rd year of SAMHSA grant funding, and that's one of the ways that we chose to utilize our funds is to have a qualified professional on staff. So that way we would be able to take referrals from outside of hospitals and have an individual available to assess and evaluate referrals from the community. And so that's how we're able to work directly with parents is having that that recognized clinician do that evaluation and be able to make that determination that it is a good candidate for AOT to be able to support that affidavit for the petition. So that's one way that we're able to support families directly.
And so what happens if the individual does not want to be evaluated?
Well, we also do have that provision, where we can order, that they be picked up by our local, CIT program or CIT teams to be evaluated. So that is an option as well.
Yeah. Have you had to invoke that at all? Has it come to that in some cases?
I think oftentimes we haven't, as part of the evaluation process, we haven't. I mean, we have when we've had individuals in program, we have had to utilize that as far as, having individuals evaluated or maybe getting their medications administered, et cetera, but not on the front end, no.
Yeah. Yeah. And, actually, Ash, it occurred to me after the conversation we had earlier this week that I should connect you with Laura because I know that's an interest of yours and is, getting more referrals from the community, and they're doing a particularly good job of that. So you guys should definitely talk.
Great.
Yeah, I'd appreciate that because right now we're only doing post-hospitalization, and the law allows for us to avoid the hospital, and it just has not been operationalized. So there's, the biggest sort of barrier right now that I see is a colleague in my own department at the county. But if I can figure out a pathway, it has to go through the designated crisis responders. But if we can figure out how to do hospital court orders, we could avoid folks having to go to the hospital at all who don't need that. So I would love to connect.
Laura, does NAMI play a role in that process?
I definitely think that we do our best to keep them apprised of the pathway in referring straight from the community, but not necessarily a direct role outside of just making sure that they're educated that this is a potential way of referring to AOT.
The majority of our referrers in Santa Barbara County are family members.
I know in Santa Barbara, I've called, since my son was dropped, we have what's called an access line. And I've talked to people there a number of times complaining about the fact that he was dropped. And they say they'll do something, and I've never heard back from them. So, I mean, I just feel like they don't want to deal with a really difficult case. So Lynn and I are going to have a meeting with the supervisor, one of the supervisors today, who seems to be interested in the ALT program. I'm going to tell her my story. I wrote her a letter and explained what had happened, and she said, "Oh, that's horrible." But I'm going to really advocate for a real AOT program in Santa Barbara.
Yeah, when all else fails, use shame. I mean, the Board of Supervisors can shame them into some action. Let's get it in the paper. It's terrible.
I'm curious, Sherry, if you're still with us, with NAMI's going to be playing a dual role in Kansas. So you sort of assisted in getting the grant. I think you're sort of a co-funder on the SAMHSA grant. I'm not sure exactly what that looks like. I mean, are you concerned that it's going to be difficult for you to champion the program if you see programs sort of going in the wrong direction?
Well, I certainly hope not. So, we're just on the beginning steps of all of this, right? So we're going to pilot it in 5 counties, and we do have a NAMI present in 4 of the 5 counties. And so it's trying to find those champions right now to serve in those areas. Riley County, I think we're good with our NAMI Flint Hills, NAMI Hayes. For Ellis County, I think they're strong, and they'll be able to, and they have a good working relationship. Both of those have a good working relationship with their local mental health centers. Douglas County, I think they will be good, strong NAMI Douglas County presence there.
Yeah.
And again, strong relationship with their local community mental health. Who am I missing? So Winfield, we have nobody there, and that's where we're going to have some challenges. And in Ford County, that's a beginning support group. So challenges in finding the champions in Ford County and Winfield. But I think the other 3, I feel hopeful and confident. But we definitely want to continue to listen to what others who have gone before us so that we can learn from them and stand on their shoulders as well.
Sherry, is there any reason why you have to roll out all 5 counties together? I mean, can you stagger it and, you deal with the ones that you have higher hopes for or better contacts in?
Right. Good. That's a good question. Something definitely that we can take to KDADs, so they're going to be the lead organization in this. And then we are partners in it along, just as the local mental health centers are partners in this initiative. So, I just really want to hope that KDADS honors their partnership with NAMI Kansas and
Yeah.
these 4 affiliates, the way we discussed a year ago.
Mhm.
And
Yeah.
so that's all still pretty loose. I'm waiting to see their budget, on that too. And the best way for us to recruit and retain champions is to have boots on the ground and monies to help pay for those boots on the ground. So I'm waiting to see their budget, and that may be a conversation that goes a little bit further once I get my eyes on their budget and find out what they're actually willing to support financially for our champions in these communities.
Yeah.
It's an interesting partnership. We're going to be, really interested to see how it plays out.
Yep, me too. It'll be fun. Let's just hope that greed doesn't get in the way.
Yeah.
I just wonder, Ruth, you've been listening. I'm just curious if you have any observations or any suggestions based on some of your experience at the county level. Any suggestions for our champions on the phone?
So going back to one of the questions that was asked earlier about creating kind of a mind shift with defense attorneys, one of the things that we've done, and we do have a coordinating center that works statewide, but you don't need one to do this. We brought partners together across Disability Rights Ohio, some local psychiatrists and local attorneys, a couple who do work with individuals with serious mental illness, and we created actually a training on responding to clients with mental illness. We held an initial round of training a couple years ago, had great turnout, free continuing legal education unit, so it helped a lot. But there were a lot of light bulbs that went off in the group because the psychiatrists were able to tell really good stories around what this looks like, what various mental illnesses look like symptomatically. And I had a lot of attorneys afterwards say, I had no idea that's what I thought it was somebody who was just a pain in my butt. And so that helped tremendously. And we just redid that training this year. And now we're doing, focusing on different legal pathways to utilize with clients and helping them talk through scenarios and the pros and cons of trying to do evaluations or competency or not guilty by reason of insanity or assisted outpatient treatment or intervention in lieu, and talking about kind of the ups and the downsides of all those things. And they get to talk through these cases with psychiatrists and their peers, and as well as folks from the Cuyahoga County Board of Developmental Disabilities. I know our Cleveland person had to leave, so we've tapped into the Cleveland folks quite a bit. It's helping a lot in terms of changing minds and changing the way that attorneys are thinking by bringing them together and having really open discussions. So that's one thing I would suggest, if it's possible, to bring some stakeholders together and think about that kind of thing, getting them all in a room and helping them to learn.
Great suggestion. And we have done that sort of at the local level, when that's an issue, and you see those light bulbs go off. And it's always helpful too, like you said, the peer-to-peer relationships. So, and we have, if you have a defense attorney who really just can't, really appreciate what AOT is, we've got other attorneys where we could connect them to, that they could, if that's helpful, have a conversation and walk through some of those issues. Sometimes they're more inclined to hear it from a peer than from somebody else.
And we started by accessing through the public defender's offices and assigned counsel lists in our state. But interestingly, I know there's somebody on here from Arizona. One of our trainers who volunteers his time is from the Office of the Legal Advocate in Maricopa County, Arizona. He pipes in virtually and helps with the training as a volunteer.
Public defender and staff are strongly supportive of AOT. I think because it's a civil court as opposed to a criminal court. and, you know, they have experience with people getting criminally penalized for not following through with treatment plans at the mental health, through the mental health court. So I think emphasizing the fact that it's a civil court is really important.
When
Yep.
we were setting up our RPP, the Recovery Pilot Project Court, which is an AOT court in King County, the defense was on the stakeholders group. We had a giant stakeholders group with judges and social workers and peers and all kinds of folks. And defense, sort of in the 11th hour, the head of defense came and was like, no, we will not support any of this, and sort of walked out. And we could have at that point said, okay, RPP is not going to launch because we don't have one of the parties here. And we decided to just launch it because defense attorneys aren't going to not represent their clients. Like, they're ethically, they're going to show up and fight for their clients. And so we just decided to go for it. And now our the defense attorneys who are with our program are the biggest advocates of AOT because they see it live, and you know, they want their clients to get good care and people to listen to them, and watching the team sort of move the system on behalf of their client, which should always happen and never happens. So just sort of encourage, if that's the barrier, just, you know, if you wait until everything is figured out, you're never going to do anything because the system is set up to not do anything. So, and there's still some legal pathways we've not explored in King County, and we're trying to open now because we punted it because we didn't have everyone there. We had to just start doing something, but it's a heck of a lot more compelling when you have a live human being there saying, we all know this guy, he is struggling. We all know that if we don't use this law that actually exists, this guy gets screwed. We just wait for him to get so ill that we have to go scoop him up and take away his civil rights. We don't want to do that. So let's do something different here. And all of a sudden the conversation around we can't, or we don't have this, or we need more resources. It's like, no, just figure out how to write a piece of paper that's called an AOT court order. It's in the law. Just like make a form, you know, let's put it in the court. The court will do whatever the hell it does with it, but let's try it. So I just sort of encourage that. I've created a lot of programs in my time as a social worker, and this one seems like the most fraught because there's always some stakeholder that stands up and is like, you're trying to do this thing. And I've just decided to keep moving forward and eventually see if they come around. And I can articulate AOT from the moral angle, from the clinical angle, from the saving money angle. And you've got to sort of have a pitch for everyone you're sort of coming to say, what are they here to listen to? And so anyway, I just like the talk about the defense agencies. That's what was going to totally trash it, and did in King County for a long time before, you know, I just said, that's ridiculous. Let's keep going. They're going to show up to the table. You know, we don't want to move the table around or rebuild the table. The table's there. Let's just all sit at it and see who comes. And it turns out they show up.
That is such great advice. That is really gold. Thank you so much for sharing that.
Yeah, Ash, I'd really like to connect with you also, just because, sorry, I know you guys are probably trying to get off if I'll make it short, but I mean, in Louisiana, we have a state-appointed agency that represent all individuals under any involuntary commitment order, the Mental Health Advocacy Service. So they were first to come out and say, we support AOT because it keeps people in the community, and that's what we want. But then at the same time, there are also people that are putting the barriers in the law so that interested parties cannot petition, but doctors and hospitals. So we're working through that. But also, Ash, kind of want to connect with you because the other problem we had in getting AOT started was at the same time, there was this real push to start law enforcement assisted diversion based on the model in Seattle by VERA, the VERA Institute of Justice, and the individual here who was the coordinator, the program director for jail diversion under VERA, was 100% opposed to AOT because it's coercive. So every single meeting she and I were in together with decision makers that were ultimately making decisions on whether or not to fund programs were, you know, pouring all this into law enforcement assisted diversion because they have all these glossy, you know, reports and, you know, pie charts and data, and they're very professional and so on. And at the same meetings, I'm saying, well, look, that's great. I guess it's really designed for people who are serial inebriates, but it doesn't do anything for these other folks who are also involved in the criminal justice system. We also need AOT. And Karina, I mean, this woman would just say, no, we don't do that. It's coercive. And so somebody in one of the committee members just said, that's a different initiative, that we need that too, but that's a separate initiative. And, it was just like really hard. I mean, we wouldn't be doing it had I not gone to this judge, because all of the resources and all of the conversations are wrapped up into this idea that law enforcement assisted diversion is a panacea to all of our problems. And so, but I would love to connect with you, Ash, directly to talk more about this, because in a lot of ways, our city is following Seattle. So I just kind of like to connect to talk about their issues tangential to AOT, but maybe we can swap info. And I mean, great to talk to all of you and put me in those other groups with Laura and you, Ash, talking about pickups. Does that have to be the sheriff or the police officer? If so, what does that look like? Could it be someone else that has?
The IT is best if you have it.
Or someone that's bonded. I mean, maybe mobile crisis intervention. I don't know if they could do well, whatever, right? So anyway, thank you all. I know you're probably
No, that's fine. That's why we do these. So, but I do have a question though, because for you, Ash, because the thing I always worry about, and I think thinking back, I was really worried about in Seattle, when we don't have the defense attorneys buying in. I mean, you're right. Ultimately, they're going to have to defend their clients, and we're going to have these cases, and they can't really stop it. But I do worry about them advising their clients, this is a paper tiger, that they have no real teeth in this. Don't worry about it. They can't do, they can really, it seems to me, undermine the effectiveness of the program by saying the wrong things and not getting their clients to, give it a shot. So did that happen at all initially?
Yeah, it did. And the way we got around that was, I supervise 2 peer specialists, and they are complete rock stars. And so the moment I get a referral from the hospital, my peers go up there and meet the person right away and give them real information. They're not coercive at all. That's not what peers do. It's never what peers are going to do.
Right.
And they just sit with somebody and say, here's what the program is, and let people ask questions and then offer wraparound services. And that has made it so they're such good engagers that the clients are asking their lawyers to opt in. And so the lawyers who don't want to opt in are saying, well, my client said they want to come in. Okay, fine. So we had that enough times where we got the information to the actual person and gave them real information.
Yeah.
They pushed their lawyer to say yes. And there's still politically, but Seattle is super progressive.
Yeah.
So if you read anything that the head of the defense agency says, like, we need to shut down all jails and there should be nothing. So the defense lawyers on the ground who are actually working in my program have to walk a very fine line, because the official stance is that they are against everything related to court in general, much less AOT. But then on the ground, they're doing the work, they're going above and beyond, they're trying to figure out how to help their clients, and they're talking to their other lawyers. And so the other thing that I suggested, I just was like, hey, as a program manager, I've started a lot of programs. It's a heck of a lot easier if you just have one person as the point of contact. Then we don't have to train your 50 lawyers. Like, if there's just one lawyer doing AOT, they can become the expert in it. It won't be stressful, like easy. I talked about it like it was this just like strategy as far as opening a program, less resources, blah, blah, blah. Really, the point of that was, if I can build a relationship with that human being and they assign one person to do it, I can actually build enough leverage to give them real information about how this works and how it doesn't. And I'm just like radically honest. I mean, with what Janet was saying with LEAD, I've done most of my career has been in crisis with homeless folks and doing diversion. This is my first gig that has anything involuntary. So I believe in voluntary care to the depths of my soul. I believe in harm reduction. I believe in it. And there is a time and a place where voluntary does not work. And
Right.
these are the patients it's not working for. So it's not enough. You know, I'm going to be the champion for LEAD and for mobile crisis teams. I was on mobile crisis teams. I started the ones in Seattle. I believe in it with my whole soul. And the clients that are getting left out of the system are the ones who need AOT. So it's not enough to talk out of one side of our mouth and say, this is the panacea, and not do something with the other folks who are getting screwed. So when I'm in those meetings, I say, yeah, I got your back. Let's divert every human being that doesn't need to be in court. Why would we drag them into court? But the ones that can't be diverted, what do we do about those folks? Because we're not doing anything right now. So that's, I think the pitch there is to not disagree. Because I personally don't disagree. I think LEAD is awesome. I think mobile crisis teams are awesome. I've helped people who are in a voluntary way do some really radical recovery stuff. And there's some folks who can't do it that way. And we don't just leave them to languish in hospitals or jails or wherever and, you know, wash our hands and walk away. That's not cool either. So I think that's, you know, a little bit there to, you know, you can believe in two things at once and they don't have to be in opposition.
It's such a false choice they want to present us with. And we can't get away with it.
Gosh, I see a speaking engagement coming your way.
My boss tells me I swear too much, so maybe not. I'm originally from Rhode Island. I now live on the West Coast where they swear less, but yeah, so you have to take that into consideration. I get very passionate.
That's great. Ready.
Swear. Those are the one where you have to swear. You know.
It can be effective.
We're getting ready to wrap up, and there's a few folks who haven't had a chance to speak up. So I want to, if anyone wants to ask a question or share a story, or this is your opportunity.
If no one else is going, I'm just going to add to what Ash said. So my son was a quarter away from graduating from UCSB as a straight A student when the shit hit the fan. So he is a perfect person for JDP. You know, he doesn't think there's anything wrong with him, but he was a great looking kid who now if you saw him on the street, you'd think he was homeless and had nothing, had no one who cares about him. It's heartbreaking. So you're on the right path, Ash. There are some people who really need help. I don't believe in forcing anyone to do anything. I mean, it's just so hard. It's a really difficult place that I find myself in, but I don't want this to be my son's life. I'd like him to actually enjoy his life, to have a life that's worth living. So whatever. I just thought I know I'm kind of on the total opposite end of where all you people are, but I hope it helps to hear that there are people who need your help.
Yeah.
You're not on the opposite end at
To
all.
become an advocate for him. Even if I can't help my son, I know there are other people who can be helped.
No, I agree with Brian. You're absolutely not on the opposite end. I think it's because of you that we're all here to begin with, Leonard. So don't give up. And if you're not able to help your son, you absolutely are helping the family that comes behind you. So
it's important to me.
Yeah.
Thank you.
Thank you all for what you're doing.
Anything else before we wrap up? This has been great. Really appreciate you all being here and sticking it out with us. And yeah, it's been a wonderful conversation. We'll do this again in 4 months. So we'll look for you then. And in the meantime, if there's anything we can do to help out, never hesitate to reach out to any one of us. We're here to help you.
Including helping facilitate contact with any member of this group or any of you want to talk to. Just get in touch with us. We'll put you together with them.
Thank you.
Thank you.
All right. Thanks,
Bye,
everybody.